18.4 percentage people had premenstrual symptoms and 3.7 percentage had PMDD. So both study indicates that majority of the participants do not experience clinically significant premenstrual symptoms, highlighting the relatively low occurrence of severe conditions such as PMDD. While the Bowen study identified that fatigue, irritability, and decreased interest as a common symptoms affecting the productivity, the current study primarily emphasized overall prevalence patterns rather than the specific symptoms profile. So recommendation: to enhance the generalizability, future research should be involved women from the various educational institutions at the community environment. So this is done with the only few colleges with the 197 samples. So we can take a large sample in the future. And subsequent studies should include pregnant women and those who are contraceptives to gain the more thorough understanding about the prevalent PMDD prevalence and its impact on the quality of life across all reproductive categories. It is advised to establish awareness and counseling initiatives in the college to effectively address the PMDD and to improve the quality of life. Conclusion: the study finding reveals that women diagnosed with PMS and PMDD experience significantly reduced quality of life across all domains of the quality of life, that is physical, psychological, social, and environmental, when compared with those without premenstrual symptoms. Even though less sample, minimal people had the PMS or PMDD, the quality of life was better with those who are having the quality of life. So this research highlights the considerable burden posed by premenstrual disorders and emphasizes the urgent need of early identification, awareness, and targeted intervention to enhance the overall well-being and daily functioning of affected women. And these are my reference. Thank you.
Thank you, ma'am. Thank you for the presentation. I request the juries to ask the question.
Hello. Yes, ma'am.
Ma'am, how is your research useful to the community? How is your research useful to the community?
Thank you for that question, ma'am. Actually, those women with the reproductive age, they will be having the irritability, anxiety, and work stress, and these are the things we are not addressing, and the women are suffering in their life because of the PMS and even PMDD. So when we identify it and we maybe in the school, if we try to have the stress management program or the screening, future we can think of some intervention for the women, and this will be definitely helpful for the women who will not talk about this much.
One more question for you. How did you handle the missing or incomplete data?
Ma'am, I have taken the sample which is nearing to my area, so I didn't have much trouble to collect the data. But that's why I recommended if I'm taking large sample, definitely it would have been an issue for me. But it's 137. It was not much difficult for the let me see, the data was not there.
Okay, ma'am. Thank you. Thank you for your presentation. Now I would like to call upon Ms. Pratika ma'am for her presentation. Before that, I would like to inform you that presenters are requested not to disclose their identity, especially your institute identity, because it will cause bias among the juries. Pratika ma'am? Pratika ma'am, are you available?
Ma'am, I am Pratima.
Sorry, Dr. Shelby D'Souza ma'am?
Yes, ma'am, I am Can I present that?
Yes, ma'am, you can share your screen.
Is it visible now? My screen is visible now?
Yes, ma'am, your screen is visible.
Good morning, madam. Is a study to assess maternal risk factors for congenital anomalies among children in a selected hospital at Godavari. Congenital anomalies are very common in the world and occur right from the birth. Some are detected in the antenatal and sometimes detected later in infancy. Congenital anomalies are functional structural damage to the individual's development from the neonatal age to the birth. In this case, the damage is inflicted while the child is still in the uterus, which determinantly affects their well-being afterward. These anomalies are major concern due to the number of children who are born with the type of congenital anomaly, which is estimated to be in the millions. Children born with congenital anomalies often face a lot of problems related to structural functional defects. There are many types of congenital anomalies. It is prevalent in children and it is extremely require medical care, family support and medical attention. It is a long-term disability caused by many factors. Hospital-based studies provide essential insights into the relationship between maternal health, environmental exposures, and congenital outcomes. Therefore, this study aims to assess maternal risk factors associated with congenital anomalies among children in a selected hospital to inform prevention, antenatal screening, and health promotion programs. The novelty pending the study. Congenital anomalies are one of the leading causes of neonatal mortality and mortality worldwide, particularly in low and middle income countries. Despite advances in critical care and identification and prevention of maternal risk factors, contributing to these anomalies remain a persistent challenge. Many existing studies have explored congenital anomalies in broad epidemiological terms. However, the scarcity of hospital-based research focusing specifically on the maternal determinants, including nutritional status, infections, medication use, environmental exposures, and lifestyle factors that predisposes to congenital malformation in the local context. The novelty of the present study lies in its context-specific approach. It seeks to assess and analyze maternal risk factors within the population attending selected hospitals by generating data that are both regionally relevant and clinically applicable. Unlike population-level studies, this hospital-based design allows for a detailed exploration of maternal health histories and perinatal outcomes, offering insights that can guide local preventive strategies and early interventions. The objectives of the study will identify the maternal risk factors of congenital anomalies among children, to find the association between risk factors of congenital anomalies with a selected amount of variables. The methodology, the research approach used for the design is quantitative approach and the design was retrospective case control design. The samples were 86, the cases were distributed equally to cases 40p and control 40p. Non-probability purposive sampling was used and it was 20 cases at a charitable institution. The tool was used demographic performer and risk factor checklist. The data analysis, the descriptive statistics, that is frequency percentage was used and to find the test source 60 in and exact test was used. Detection method obtained institution permission after ethical clearance. The study design and the protocol to all the participants. Explain the study design and protocol to all the participants. Obtain consent for the participants. Distribute the risk factor checklist. The result, the median factors. Most of the mothers were aged 26 to 35 years with only 9.3% control, 4.65% was each age below 20 years, and few aged 36 years or above. All the mothers had some level of education with only 2.83%
percentage had a primary education and majority community higher studies. Most mothers were homemaker and few were employed. Among fathers, only 2.33% were below 25 years, while the majority were above 25 years. All fathers were educated in 62.79, the control, and 44.19 cases, completing grades of 9 to 12. Most were engaged in economic and livelihood-related occupations. Regarding the residents, most families lived in rural areas, that is 62.79% in control, 69.7% in the cases, with few residing in suburban and urban settings. The most participants had carried 2 to 3 children, and vaginal delivery was the predominant mode. The control and pregnancy was 55.81%. Most babies were term with a few were preterm or post-term in the case group. Male newborns showed a higher occurrence of congenital anomalies than the females. Most cases had normal birth weight with few underweight. Stillbirths and bleedings were rare, that is 2.33%. First birth order was most common, 46.51%, and higher birth orders were few. History of abortion was minimal and no history of birth defects were reported in the case group. Nearly all mothers in the two groups received folic acid. Diabetes, obesity, pleasantopenia, passive smoking, alcohol consumption, accidents, anemia, vitamin D deficiency, asthma demonstrated identical frequencies in both the groups. No active smoking, alcohol consumption were reported by any of the participants. Environmental factors: among the total 43 cases, none had exposure to dog infection or inhalation of polluted air during pregnancy. Exposure to various forms of radiation during a prior pregnancy was seen only in the case group, pointing towards the potential risk trend. Socioeconomic, healthcare and antenatal care follow as little more prevalent among the control group than school. More cases were from families with low incomes, implying an association between socioeconomic status and congenital anomalies. Family history of birth defects was noted slightly higher in the case group, and so as managed was evenly divided into groups. Association: to find the association, chi-square and Fisher-Tropsch was used. Fisher-Tropsch test was used to find the association between the category of variables. The comprehensive analysis of various maternal, environmental, socio-economic, birth-related, psychological, maternal risk factors did not reveal any statistical significant association with the occurrence of congenital anomalies in the children, as all were p-values exceeded the standard threshold. Maternal characteristics such as age during pregnancy, diabetes, hypertension, obesity, intake of folic acid, and anemia showed no significant difference between the case and control groups. Environmental. The results. Environmental exposure. Significantly, there was no association with the environmental factors. Socio-economic indicators like income level, antenatal care, and access to health care, as well as growth of pregnancy factors such as air consumption and work injury, also show no meaningful statistical difference. Psychological and maternal factors, including stress, psychiatric illness, and maternal smoking, occurrence of occupational exposure, that similarly not associated with increased risk. These findings suggest that no single risk factor examined in this study was independently associated with congenital anomalies in children, highlighting the potential role of multifactorial of genetic influences and the need for further large-scale
So we have a time constraint of 5 minutes. So we move on to the question and answer session.
What etiquette consideration did you take into account during your study?
So this study was in Sam for over
Any positive findings you found? Because in spite of all, there is nothing you find in the study.
Yes, ma'am. Because we assumed that there is what is that the relation between the maternal risk and congenital anomalies. Because I see any number of people congenital anomalies in a hospital thinking that there is correlation, but when we have just come across, there is no any association between the maternal risk factors and the congenital anomalies.
Okay.
But then, like we have planned, since my sample size is 86, we are planning for a larger sample to see anything different is present.
Thank you for your presentation. Now I would like to call Ms. Bethnia Malkina for her presentation. Slides will be shared from our image. Are you there, ma'am?
Yes, ma'am. Can I start?
Yes, ma'am, you can start.
Good afternoon to all. Thank you for giving me an opportunity to present my study. My purpose statement is to prevalence of overweight and obese among adults in Karat Taluka in Maharashtra. My objective was to find the prevalence associated between overweight and obese adults. Introduction. Obesity was once predominantly observed in industrialized nations. It has now become a significant issue in many developing countries, but obesity result is an imbalance between energy intake and expenditure causing excess body fat. It is increasingly prevalent worldwide, affecting all ages and genders, including in developing countries. It is characterized by the abnormal growth of adipose tissues and results in a body weight increase of 20% or more of the standard weight. In the year of 2022 census, there were over 890 million adults over the age of 18 who were overweight and obese, and 43% of the adults over the age of 18 years were overweight. 43% of the men and 44% of the women fall into this category. The WHO Southeast Asia and African regions had 31% of prevalence of overweight, while the Americans had 67% of prevalence. The global epidemic of overweight and obesity is rapidly becoming a major public health problem in many parts of the world. It leads to a substantial decrease in the quality of life and life expectancy and account for heavy expenditure in the provision of healthcare. Developing countries are experiencing a nutritional transition characterized by a reducing in the prevalence of nutritional deficiencies and increase in overweight and obesity occurrences. Next slide. So for this, the methodology was for this, the research approach was used, the quantitative approach was used, and the cross-sectional observational design was used, as well as the samples were taken selected by simple sampling technique. The overweight and obese adults aged over and between the 20 years to 60 years were participated in this study. The study enrolled 125 participants selected through simple random sampling to ensure the representative samples. The study samples were taken from Karat city, where four villages were selected for doing this study. The key parameters were included like weight and height with calculated body mass index, that is BMI. The analysis was performed by using InStat software. The findings revealed a significant insight into the prevalence rates of overweight and obesity within the study population, highlighting the needs of public health interventions to address these specific issues. So my result was, in first table, the distribution of the body weight across the age and gender. For this, two categories were formed. That is, first is The next slide, next paper, it shows an education and occupation where influencing or affecting on the weight. In that, the overweight category shows the professional or honored degree or graduate or postgraduate peoples were included in this study, and those are showing majority of the overweight category, that is 34, that is 47.89%, whereas the normal category were from high school certificate or middle school certificate, whereas in occupation, the professional, semi-professional, clerical or shop-owner partners were showing 49, that is 39.52% category from overweight, while the skilled workers or semi-skilled workers or non-skilled workers or unemployed showing 23, that is 32.39%. Next slide. Next is according to diet and
Sorry to interrupt. There is a time constraint of 5 minutes. Can you please keep to your main findings?
Yes. White vegetarian showing 12 and non-vegetarian showing 41.42%, while unmarried or divorced widows are 30 and married are 61, that is 39.87%. Next slide. While the consumption of alcohol, majority of the 8 peoples were showing consumption of alcohol, while 69% were not showing consumption of alcohol. In tobacco or machine consumption, 18, that is 40% of people consuming the machine of tobacco, while 54, that is 36% of people not showing the consumption of machine or tobacco. Right? The next discussion. In this study, because of high prevalence of underweight, that is 36.94%, compared to those over 40 years, 3.57%. But the overweight category was more prevalence among those over 40 years, that is 29.76%, compared to younger age or younger group, that is 23.42%. As compared to my study with Parker and DBR, study results show that the prevalence of obesity was more among the age group of 30 to 40 years, that is 26.4%, and 20 to 30, and 40 to 50 years, that is each group 25%. Yes.
It's already time is over. So I will ask a question regarding the what problem or game does your study address? What problem or game does your study address?
Yes, ma'am. While I am collecting the data, some people are not cooperating for doing this study because my study is for from community area. So some people are saying that they don't want to participate in my study.
How did you overcome that?
Yes, ma'am. I share them first participate all individuals in one group or in one hall, and after that I convince them to convince them and I tell them what is the benefit of including in my study. So they convince afterwards I participate them in my study.
Okay, ma'am. Thank you. Thank you for your information. Now, I would like to call upon Professor Satish Rajamani for his presentation. Your presentation slide will be shared from our end.
Good afternoon, I'm Satish Rajamani. It will be better if you share my slide from your side. Otherwise, I will try to share from my side. Okay, ma'am. Thank you for sharing my slide. Let me start my presentation. So it's not my presentation. The background of the study, the nursing profession is known for its compassion, have external perception problem issues in the recent years. For doctor, we need to overlook intellectual and healthcare quality and the healthcare professions. There are a lot of The formation of public image affects the nursing students' identity and care behavior. Early identification of negative perceptions can enhance the professional development. Studies indicate that nurses' public image is perceived negatively in the recent time. Next slide, please. The first year students view nursing in a respected caring profession as a caring profession in a respected manner, shaped by its own idealism. But both year students report decreased positive perception due to workplace realities and professional stressors, developing a more practical focus and competencies and challenges in many subjects. Nursing provides a holistic care to advocacy, disease prevention, health promotion, education, counseling, collaboration, research and administration. Despite their contribution, nurses are not adequately recognized. They face difficult working conditions, causing stress and fatigue. About 13% of nurses dislike the profession due to low pay, poor administration, and workload. These are the things which make me do the study, and the study is focused on this. The particular study is focused on next slide, please. The statement of the problem, perception in transition, a comparative analysis of nursing image among BSc nursing students at different academic stages in a university pattern. So the objectives of the study to compare the perception of nursing image between first semester nursing students and nursing interns at the School of Nursing University categories. Next slide, ma'am. So the research design, research approach is here. The quantitative research approach is selected, and the research design is non-experimental research design. We got by comparative survey research, and the value of the study is nurse image. The setting up the study is School of Nursing University. The populations were nursing students. The sample were including the first semester BSc nursing and nursing interns. Next slide, ma'am. The sample size were the total sample size included 170 students from BSc nursing first year and BSc nursing interns of 110. Sampling technique character was not proportionate convenient sampling technique having character. Research tool selected for the study is a standardized tool which is assessing the nursing image, and it was developed by Walker and Porter in the year 1991, and social demographic variable added with the tool, and the mark recognition method consists of self-reporting questioning method, group survey having developed, and it has been surveyed among the students of the whole class, and data were collected, and data analysis is done through descriptive and inferential statistics. We have used the AI Julius AI tool for analyzing the data. The result and analysis is seen in the next slide. So here the demographic variable of the distribution of the sample shows generalized both the section BSc nursing first semester and BSc nursing interns are having the highest number percentage compared according to the names, and in the first the case of residents, the BSc nursing interns majority are from the urban area, whereas in case of BSc nursing intern, majority of the samples come from the rural area. For religion, the Hindus were dominating in both the classes. So regarding the people coming from there, any of the relatives of the nursing profession, like we have asked two questions like, do you have previous experience in the hospitalization? Majority of the sample in the interns have shown told that they have previous hospitalization experience they were having there. Comparing to the BSc nursing first year, most of the students does not have any exposure to the hospitalization. And you can see the next slide. We have estimated the level of perception and related to the nursing image all over the sample. 73% students are in case of females, you can can you go for the previous slide? Yeah. In case of female, it was found that the first semester 70.41% have the high percentage, but in case of BSc nursing intern, significantly girls have a higher percentage related to the nursing image, 81.12%, and that was to be noted. The females in the interns have the high percentage towards nursing image comparing to the BSc nursing first semester. And next slide, please. So in the next slide, we have done the association to identify is there any kind of significant difference between the in the perception level between the interns and the first semester student. So we got a significant value 0.05 and the next estimated it was 5.64 for a year later. It was found that there was a significant difference in the level of perception between first semester and the post-semester student. And next slide, please. So the discussion of the study shows that various studies have put in the present study findings. The result in our study says that in terms of having significantly more lesser perception towards the nursing page comparing to first year students in first semester students.
Hello, sir. Hello, sir. It's the time limitation. So I would like to ask question. What limitation did you face in conducting this study?
What limitations we connected that some of the samples like we got the academic sample, some students are not ready to answer the questions. So in the data collection we expected we get more samples, but some students are not answered the questions. Other than that, we don't have any kind of limitation while collecting the data.
Sir, how we can handle the missing or incomplete data?
Actually, we didn't get any incomplete data. Actually, those who got the Google form, they all filled that form. We have done the sample size estimation. More than the sample size, what we got in the analysis phase, we have taken the sample so that the precision is comparatively high one. Because the sample size, what we estimated for 140, total 140 students in each class, we get around 90 students. So, but we got 117 sample in the first semester and 110 sample in the second event. So, the limitations, like we got a good number of sample identity.
Okay, sir. Thank you for your presentation. Now, I would like to call Mr. Chetan Naik for his presentation. Mr. Chetan Naik, are you available, sir? Mr. Chetan Naik? Sir, your voice is not clear, sir. Sir, please check your audio, sir. Sir, it's echo. Okay, sir, you can continue. Yes, sir, you can start your presentation.
Teaching program or biomedical based management, the knowledge of the post-secondary staff. So based on your introduction, biomedical based management, they are better the same and helping government in a healthy facility. It includes the process of consideration, the collection, the transport, and taking the disposal of waste product, during a medical procedure. They have more diagnostic research, they indicate the biomedical based management are only affected maybe affected the patient and the doctor who are working in the area and also not a significant environmental hazard and the spread of infection diseases like HIV, hepatitis and hepatitis C was the unseen from a medical practice. So based on this approach, housekeeping staff. The second objective may be to find an structure which will overcome by contribution and housekeeping staff. The third objective is to find an association between the previous knowledge to and certain demographic variables. So in the Jalgaon methodological chapter, we taken a research approach and decided we taken a computer research approach. And the first experimental one group of image and poster design. Second, we compare selected hospital development district. The target population hosting staff. The sample set to be sample. The purpose sampling technique. We are coming into the data. We use the data. The housekeeping staff who are currently working in the state hospital. Individuals who are directly involved in the disease management. Both male and female housekeeping worker who are used in the year and above. The participants who are available the type of practical activities are called as individual area. Experience criteria will be available for those who are recently added on the training of workshop on the private education management. The tools we are reviewing tools will structure demographic profiles and structure the knowledge personality is based on the causes of the effect of a private education management condition. The validation will be a statement the validation the subject expert. We come to result aspect data we made here only chapters of the headings frequency percentage the baseline of demographic data the age, gender, education status, the language and area. We come to age condition the more than 30 to 40 people who are having 32% of the members in the age condition gender females will be more area educational status the maximum population peoples the language people who are speaking in 98%. Area comparing other 80% more on the housekeeping staff. The second the result of comparing frequency and percentage distribution of previous and post knowledge group on subject based on the sample model reading the knowledge may adequate the model or inadequate the model adequate comparing the previous condition eliminate they are having 26 the model they are having 54 the adequate they are having 2 compare the post condition the maybe increases the knowledge level if the adequate is equal to 50 test post may change to 52 the model may be 52 may change to 20 adequate is going to change to the condition of post condition that is completely new the standardization of the test which is class of perfect speaking the completely test condition the may be changes the mean and median is also increasing the standardization of the test there are 7.30 the standardization post changes to 6.35. In the last the result of the company association between the knowledge level selected demographic level to move on the understand the post knowledge will take only about adequate and moderate condition every aspect of the demographic age gender education status and language and area so the two things are having the p-value is less than 0.05 is showing that or the economic variable will not be or the economic variable is not having association between the pre-test and post-test score. The computer system condition is structure teaching program. The product is significant improvement of knowledge regarding the biomedical management. The mean knowledge score increases from the 10.1, 85, and pre-test to 51 levels, 51 level post-test. The return knowledge level ranges from the 2.5% range to 6%. The post-test after implementation. The STP effectively enhances the understanding of the basic segregation, coding, and exposure protocol on the housekeeping staff. As the improvement was steadily ma'am.
So, 1 minute, sir. We are having
Hello.
one more participant. I'll call back to you, sir.
Yeah, thank you, ma'am. Thank you so much.
Thank you, sir.
Good afternoon to all, respected dignitaries of DICE and delegates who are presented in offline and online. And I'm going to take a presentation on my title of the study, Assess the level of knowledge regarding child abuse among housewives aged between 30 to 40 years at Parvati. And concise my abstract, the critical public health issues in India, 53% of children face some form of health abuse including physical, mental and sexual abuse, with cases increasing annually according to National Crime Records. The study focus assesses knowledge level regarding child abuse among housewives aged between 30 to 40 years. The sample size, with the sample size of 30 housewives from Parvatipuram, Kadalur district, the key findings are 63.4% had moderate knowledge with mean score of 10.6, which is 53%. Let's come to the introduction. The study covered several Indian states and examined different forms of child abuse. In the form of physical abuse, most victims of boys often abuse their own parents. Sexual abuse, both boys and girls are affected mostly by their own people. In the form of emotional abuse, the most hidden and common form usually occurring within families. These findings shows that child abuse is a nationwide problem that needs immediate attention and action. Regarding the need for the study, the previous study shows that young children aged 5 to 12 years are most vulnerable to physical, emotional and sexual abuse. Over 88% of physical abuse cases occur within the home environment. If parents or caregivers lack awareness, cases may go unnoticed and unreported. Therefore, assessing knowledge among housewives can help identify gaps and strengthen community-based protection strategies. Statement of the problem describes a descriptive study to assess the level of knowledge regarding the child abuse among housewives aged 30 to 40 years at Parvatipuram. My primary objective stating that type of family. Come to the discussion, majority 63.4% of housewives had moderate knowledge on child abuse and 13.3% had inadequate knowledge, which is 63.4 moderate and 23.3% have adequate knowledge. Overall we scored 10.6 and plus or minus 3.4. Mean percentage is 53%. Indicates fair awareness but need to improve. Education. Come to the education part. According to the demographic data, education and family, it's significant. Education, strong influence awareness, educated mother more informed about child rights and abuse prevention. In family life, nuclear family shows better knowledge possibly due to their parenting responsibilities and better information access. So other three demographic data falls under the non-significant link with age, such as age, religion and socio-economic status. And come to the recommendation. On the basis of the finding of the study, following recommendations have been made. The similar study can be done on the large sample to validate and generalize the findings. The same study can be conducted at different settings and population. Quantitative study can be conducted. A study can be done to evaluate the effectiveness of structural instruction module on child abuse among housewives between the age group of 30 to 40 years. And come to the conclusion, parents still have limited knowledge about the child abuse. Awareness is a key for prevention and child protection. Children ensure a healthy and strong nation. I would like to quote of Nelson Mandela with closing of this presentation. The Mandela said that, let us reach out the children, let us do whatever we can to support their fight to rise above their pain and suffering. These are all my reference. Thank you.
Thank you, ma'am. Thank you for your presentation. There are two questions for you. One is, why did you select a particular age group, that is 30 to 40 years? Is there any specific reason?
No, ma'am. Actually, these studies I have taken for pilot study. I just for doing trial. Then my future study will be a large scale study. I would like to do a large scale study.
Okay. So, what recommendations or protocols you want to say that government has to adopt in its policy? So, what policy or protocols do you recommend for the government from your study?
Actually, this child abuse is comes under some of the sensitivity. Nowadays, the child abuse are most of happening inside the world, overall the world, I think. Okay, so many literature say that because of negligence by the parents or negligence by the caretakers, because due to their pressure, work pressure or external pressure, they all come and show their in the form of abuse, like physical abuse, whatever abuse, because of the external pressure. What the government has, what I recommend to government, many rules and regulations was government have done, but it's not yet implemented. So it has been made in tight manner and it should be in strict manner.
Thank you, ma'am. Thank you for your presentation. Now, I would like to call upon Mr. Hari for his presentation.
Hello, ma'am.
Yes, sir.
Can you hear my voice? It's great. Now I'm sharing my slide. Can you see me, ma'am?
No, sir. Your slide is not visible.
No? Is it
Yes, sir. Yes, sir. Yeah, your screen is visible.
Yeah. 1 minute. No, just 1 minute. Now this is visible, ma'am. Hello, ma'am.
It's so you can start. You have a time constraint of only 5 minutes. Please be faster.
Okay, ma'am. Problem statement is effectiveness of just spiral on the pain on the parascopic post CAPG is a big. And the background legend of the post surgery including the coronary artery bypass graft is the process. The recovery is often involved by significant challenges. The problem is mainly the faith and fear of the major patient parascophobia and irritation, fear of movement. This takes into the physical leading the patient and the overall recovery. The question is, can a simple tool, the big investigations in not immense spine can actually produce more pain and fear movement in the patient who have undergone same surgery. The main cause is physical level of pain the both patients, and second, the evaluate the level of parascophobia the same patient group, determine the effectiveness of the to reduction of the parascophobia, and identify the association between pain and the parascophobia and patient development. The methodology, prospective experimental study, study design is that one group pre-test and then post-test prospective experimental design. The sample conducting the questioning for Godavari, state and 18 hospital. India sample for 60 post-AFC patient age 40 to 80 years, and the exclusion patient post-safety via and the hemodynamics paper with the maintenance scale we have used for upper state score less than 25, and the pain measure using the visual activity. The parascophobia was measured by using upper scale. The study procedure and the analysis, post-intervention assessment day 40, and the post-intervention assessment day 7, and the intervention of justified intervention of justified applications, and the baseline assessment is mainly the pain and parascophobia. So, in that case, the data was analyzed using the resource side, the time, and the man result test to the SPC, the P, the value is less than 0.05 was considered significant. And the participant of demographical, in the demographical, you can see that the male, there is mainly the 66.7%, and the females are 33.3%, and apart from that, it is also in the mainly that low class people are 41.7%, and the middle class are 50%, and the high class are totally 8.3%. The result is significant reduction of the pain, mainly the result is significant reduction of pain. The statistically significant reduction in the mean pain scores was observed over a 14 days intervention period. The P level is less than 0.7. This demonstrates the effectiveness of chest fiber in the managing the post-operative pain. So in the baseline, there is 43.5 step, and in the day 7, 39.7 is there, and the day 14, there is the effect of 8 is there. And as a result, significant reduction in parascophobia, mainly the similarly the fear of movement, mainly the score decreases significantly over 2 weeks. The P value is less than 0.1, indicating the patients felt more confident and less fearful about the moving after the chest fiber was applied. So the baseline is 4.3, 4 is there, and in the day 7 is 39.45 is there, and the day 14 is 35.8. So result, the association to socio-demographic status, while age and the gender shows no significant association with the pre-test course. So socio-economic status was found to be a significant factor for both pain and the parascophobia. The pre-test scores are the age 0.056 and gender 0.072 and the socio-economic status 0.03. And in the parascophobia pre-test scores are age 0.61 and 0.82 and the socio-economic status is 0.045. Discussion and the conclusion, the key findings, the chest fiber provide the mechanical support to the statement, effectively reduction of the pain during the movement. By increasing the pain, the binder also helps to elevate the psychological fear of the movements. This combined effect that facilitate the mobilization and the better participation in the push-up day patients progress. Conclusion, chest fiber is simple, non-invasive, and the effective intervention for the evading the pain and the parascophobia. The post-stage patients significantly enhancing the recovery and the rehabilitation outcomes. Limitation and recommendation, study limitation, lack of control for persons, short for period 40 days, and then limiting small sample size. Recommendations person in cooperative just kind of the standard of cooperative case policy implementation, training nursing staff and the proper application and the monitoring, direct further longitudinal studies with the large and the more diverse samples to explore the long-term effects. That's it, ma'am.
Thank you, sir. Thank you for your explanation. So, what difficulties you have faced to define of data collection?
The thing is that many of them are not evolving and many of them are saying they are accepting that guideline. So we have made them to at least we have given the counseling before that. There are many because some of the doctors are not willing and some of the doctors. So these are the way we have faced situation. But some of the doctors are willing to take out and they need to give the permission to do it. And this is the main thing. Other than that, there is nothing else.
Thank you, sir. Thank you for your presentation. Now, I would like to call upon Dr. Vitanjali Patna for her presentation.
Yes, ma'am.
Yes, ma'am. You can start presenting.
Is it visible now? Hello? Is it visible now?
Your slides are not visible.
I have shared.
Your screen is visible, but not your slides.
See? Now it's visible now?
Please open your file now.
Yes. It's open only now.
Yes, ma'am. Now it's visible.
Can I start now?
Yes, ma'am. You can start.
Okay. Very good afternoon to all of you. Myself, Dr. Vitanjali Patna. I am here to present my presentation at the International Conference at the Godavari College of Nursing, Jalgaon. Title of the research: the effectiveness of sesame oil on prevention of diabetes among the patients receiving the chemotherapy. Objectives of my study were: first, the effect of sesame oil on prevention of diabetes among patients receiving chemotherapy. Second objective, to find an association between diabetes score with selected social variables among the patients receiving chemotherapy. Diabetes is an inflammation of the brain which may lead to the pain, edema, hardening of the veins or palpable thread. Globally, 57.7% of human cancer cases which are required chemotherapy from the 2018. By 2040, the number of new cases is expected to rise to the 26 million. So the chemotherapy is a fundamentally different from the surgery and the radiation therapy in cancer treatment. Chemotherapy induced diabetes with reported incidence rates is high at 70%. The novelty of my topic is natural, easily available and low-cost intervention, because the sesame oil is not routinely used in an oncology care for the diabetes prevention. Introducing a simple, inexpensive and non-oncological method which offers innovation compared to the usual protocols like the bone compress, dilution and the slow infusion. Nursing-led preventive intervention. The study highlights an evidence-based complementary therapy that the nurses can independently implement. This will strengthen the nursing autonomy and holistic care, which is a unique angle compared to the traditional
in the next cycle of chemotherapy, the sesame oil was used for the study was 100% pure. Control group has received routine care protocol as per the hospital policy. For the control group also daily phone call were done. About the post-test, after application of pure sesame oil on the 16th day of post-test conducted by using the same tool. Out of the 70 samples where we have enrolled 35 pair control group and 35 pair experimental group. But at the post-test, we found that 2 patients were dropped from the study. And so 33 samples from the experimental group followed in the post-test. This is my finding.
Mrs. Kirtimala for her presentation. Slide will be shared from our side. Mrs. Kirtimala, ma'am, are you available?
Yes, ma'am. Yes, ma'am. I'm available. Good afternoon, ma'am. Yeah, today I would like to present a study to assess the proportion of endometriosis symptoms and its contributing factors among late adolescents of degree colleges in Bangalore. Next slide. Coming to an introduction, endometriosis is a chronic estrogen-dependent gynecological disorder characterized by the ectopic growth of endometrium, often leading to symptoms such as pelvic pain, dysmenorrhea, fatigue, and infertility. Though traditionally considered a disease of adult women, studies now confirm that symptoms often begin during adolescence, typically shortly after the marriage. Despite this early onset, diagnostic delays average between 5 to 7 years globally, largely due to normalization of the menstrual pain, poor menstrual health literacy, and the under-recognition of the adolescent pain presentation. And several studies also have shown that adolescents with persistent dysmenorrhia and unresponsive analgesics or hormonal therapy can have early stages of endometriosis, and it is confirmed by the laparoscopy. However, in many cases, adolescents go undiagnosed due to the misconception that endometriosis is a rare before adulthood. Next slide, please. So I have a supporting study, a hospital-based cross-sectional study was carried out in Tamil Nadu in India, focusing on adolescents aged 15 to 19 who are presenting with the pelvic pain, and they found that almost 31% had a feature suggestive of endometriosis, and it is based on the ultrasonography findings as well as the symptom profile. So irregular menstruation, early menarche, and family history were also strongly associated with this, and this emphasizes the importance of non-invasive screening tools for adolescents and team contextual support for study in Indian college setting. Next slide, please. So again, one more study, the systematic review, which is titled The Prevalence of Endometriosis in Adolescents with Pelvic Pain, and it was aimed to estimate the prevalence of endometriosis in adolescents, and where 19 studies were involved and 1,243 participants were involved. About 64% were found with the endometriosis, which is ranging from stage 1 to stage 4. Next slide, please. So this is the novelty and the need for the study, and this study is focusing on the prevalence of the endometriosis among the adolescent girls, and this group is often undiagnosed and overlooked in the clinical and research setting. The study aims to promote the early recognition of the symptoms for timely diagnosis and management, and early detection is very important as to prevent the long-term problems such as pain, infertility, and emotional stress. And this study is aimed to provide empirical evidence that can inform future policy shape, educational content, and empower healthcare providers to recognize and respond to adolescent reproductive health needs more effectively. Next slide, please. Next slide, please. The objectives of the study is to estimate the proportion of endometriosis symptoms in late adolescent, identify significant contributing factors related to endometriosis symptoms. Next slide, please. So the research methodologies are research approaches and research design, which was involved in quantitative research approach and descriptive survey. The samples were the adolescent girl aged between 18 to 21 years, and sample size was 278 adolescent girls, and sampling technique, which was involved non-opacity convenient sampling technique, and the selected degree colleges were selected in Mangalore, and variables, endometriotic symptoms and its contributing factors, experience variables are age, height, weight, BMI, age of menarche, and measuring tools are the demographic performance, checklist on tool 2 checklist on symptoms related to endometriosis, tool 3 checklist on contributing factors related to endometriosis. Data analysis was done by using mean, frequency, and standard deviation. Next slide, please. So the data collection method, ethical clearance and permission was taken from the consent authority, and participants were selected based on the predetermined inclusion criteria, and the purpose of the study was to explain the informed consent was obtained from each participant. Next slide. And data were collected by using the three tools, that is tool 1, demographic performance, tool 2, checklist on symptom related endometriosis, tool 3, checklist on contributing factors related to endometriosis, and participants were instructed to read each item carefully and mark the appropriate responses, and the confidentiality and anonymity of the participants were ensured throughout the data collection process. Next slide. So, the analysis and interpretation was done in the three sections, that is demographic and physical characteristics. In this section, there were the physical characteristics like age, height, weight, BMI, age of minority, and section 2 where we had some of the symptoms, and each symptom was individually replaced against the diagnosis of the endometriosis, and section 3 which was contributing factors of endometriosis, and this section evaluates the influence of lifestyle factor, family history, and medical conditions of the endometriosis diagnosis. Next slide. And the demographic performer and physical characteristics, age, the mean score was 19.38, standard deviation 1.15, height 157.72 and standard deviation 6.65, weight 650.92, standard deviation 9.19, BMI 20.45, 3.46, age of minority, mean 12.60, standard deviation 1.21. Next slide please. So the demographic and the physical parameters show no statistical significant association with the endometriosis, that is p-value which is less than 0.05. Although certain trends were observed, that is the negative coefficient of the weight and age, these were not strong enough to conclude any predictive relationship. So it suggests that there is not independently influence or predict the presence of endometriosis in the study sample. Next, please. The symptom checklist assessment. So 191 participants, that is 68.7%, experienced 2 or more symptoms which is associated with the endometriosis, and this proportion indicates a significant overlap of menstrual discomfort and suggests that large segment of late adolescents may suffer from underlying undiagnosed gynecological conditions. Next slide, please. So this is a chart which depicts the endometriosis symptoms. You can see here most of them, that is about 80%, had a mood swing, and most of them had the fatigue symptoms, and as well as about 70% and about 9 painful menstrual cramps. The adolescent girls are reporting. Next slide, please. And this is same thing. Next slide, please. So among all the symptoms evaluated, only painful urination during menstruation or before was found to be significantly associated with the diagnosis of the endometriosis, and other commonly reported symptoms such as menstrual cramps, fatigue, mood swings, and nausea were frequently present, but not statistically significant. Next slide, please. So next, coming to the third section, that is contributing factors. The evaluation of the contributing factors showed that 144 participants, that is 51.80%, had a high intake of processed food sugar, while 137, that is 49.28%, reported frequent stress, and 136, 48.92% had sedentary lifestyle. Among all variables, stress showed a statistically significant association with the endometriotic symptoms, and which is identifying it as a key modifiable risk factor. Next slide, please. So this is a pie chart which depicts the contributing factors in percentage. So you can see here, that is the stress symptoms. The adolescent girls experience this, it is a more portion. Next slide, please. From the lifestyle and family history variables, only a family history of miscarriage showed a statistically significant association with the endometriosis. Other factors such as high sedentary time, processed food intake, stress symptoms, and hormonal medication usage were not significantly related. Next slide, please. discussion. This was a study which was conducted in the southern India among adolescents who indicated that 70% of the participants experienced dysmenorrhea and other overlapping gastrointestinal aggregatory symptoms, and it is supporting the study observation that painful cramps and mood disturbances are most among the frequent complaints. And similarly, results from treatment, it was found that nearly 1/3 of the teenage girls reported menstrual pain. So severe is impacted to the school attendance as well as state evidence of pain fatigue reported by the participant in this study. Next slide, please. Yeah, coming to the conclusion. So this endometriotic symptoms are both common and under-recognized among late adolescent girls. These symptoms are influenced by several biological and behavioral factors, and the significant association with the stress emphasizes the need for integral mental and physical health care strategies in the menstrual health management. And the study highlights the necessity of early detection strategies, menstrual health education, and inclusion of adolescent gynecological issues in the public health policy. And we have to make sure that the students are aware of the programs targeting the students, and academic institutions can be pivotal in improving early care and reducing long-term complications. So these are the few references of my study.
Hello, ma'am.
Thank you. Thank you for the opportunity.
Hello, ma'am.
Yes, ma'am.
Ma'am, there is one question. What limitation did you face in conducting this study?
Pardon, what?
What limitation did you face in conducting this study?
Yes, ma'am. We had selected 18 to 21 age group late adolescent girls, and our setting was in the degree colleges, and I had the limitations of getting all together 18 to 21 in the different batches, and I had a limitation to get all together to conduct this study. But then we could get some 278 participants who in India, and then we would make sure that we could conduct the study.
Thank you.
Thank you so much.
Thank you, ma'am. Thank you for your presentation. Now I would like to call upon Mrs. Sangeeta Pandit for her presentation.
Yes, madam, I am here.
Yes, ma'am.
My slides are visible, madam.
Yes, ma'am. Your slides were visible.
Can I start?
Yes, ma'am.
Yes. Good afternoon. Myself is Sangeeta Pandit, presenting the paper. So background of the class study: understand our risk of poor nutrition due to the unhealthy eating habits. Millets include a very high nutritional value, but rarely included in the modern diet. Creating awareness can increase their consumption among the youth. Pamphlets serve as a simple tool to improve the healthy food choices. So introduction India is organized immediately in the 2023 to make the people aware about their benefits and reduce their ills. So they form a vital part of daily diet which contain the essential nutrients like vitamins, minerals, which helps to maintain the good health. Currently, India is the largest producer of millet globally. These grains is rich in protein, fiber, which supports digestion and helps regulate blood sugar level. In 2023, the United Nations declared the International Year of Millets to increase awareness about and its benefit to the humanity. So, need for my study, adolescents have often lack of awareness about nutrition benefits of millets and diverse processed foods leading to the poor dietary habits. Millets are essential nutrients but are under consumed due to the limited knowledge and the misconceptions. And education pamphlet is a simple, low-cost method to improve awareness and increase the healthier food choices. So, researchers have done this study is needed versus the such as a pamphlet can effectively increase the knowledge and promote the millet consumption among the adolescents in selected parts of the pyramid. So, problems of my study effectiveness of pamphlet on awareness and consumption of millets among the adolescents in selected villages in the pyramid. Objective to assess the level of knowledge about millet awareness and consumption of millets among the adolescents. Second, to assess the effectiveness of pamphlet intervention of awareness and consumption of millet among the adolescents in selected colleges in the
young adolescent age including the 18 to 20 years of age. Technique is a feminine sample hypothesis. Methods of data collection, interview methodologies with a focus group discussion with a purpose structure questioning as a pretext. The self-prepared structure questioning was validated from the experts. Before data collection, ethical clearance was obtained from the concerned institution, Krishna Vishwavidyalaya, and for the study participants. Study done in month of June 15 to 30 June 2024. The study purpose was explained to the participants and data was collected using the self-prepared questioning to assess the knowledge level in the pretest of the samples. So intervention given as a pamphlet focus group discussion to assess the post-test level on the consumption of millet among the after 7 days post-test level. Intervention includes meaning, definition of millet types, locally available millet, nutrition benefits, support growth and development, simple millet recipes, snacks, etc. So develop knowledge was assessed based on the following scoring criteria, that is 4 knowledge 0 to 7, average knowledge 18 to 30, good knowledge of 8 to 20. And this is there next 0 there are not significant difference between the mean pretest and post-test score of effectiveness of a pamphlet of awareness and consumption of millets. H1 there will be a significant difference between the mean pretest and post-test score of the effectiveness of the pamphlet and the consumption of the millets. So research variables, independent variables that is pamphlet or awareness of consumption of millet, dependent variable knowledge level of adolescent students who is studying in KCP college in the Kerala. Demographic variable, age, family, income, type of family, education, dietary pattern and the health problems. So results in that two is divided into the two sections, that is section 1 demographic data of the sample section, second is the structure questioning on the level of knowledge and awareness and consumption of millet among the adolescents. These are the results in that age maximum peoples in the age that is 70 years, 56.67 and 50.50% of the females are included. One income more than 30,000 that is 36.67 and 50% are coming from the joint family and 58.33% of taking the non-rich dad. So in the table comparison with the level knowledge level pretest and post-test on the pamphlet on awareness and consumption of millet among adolescents. In the pretest knowledge score that is in average maximum people that is 67% of the adolescents. In the post-test 23% are average and 74% are good knowledge. In the table in comparison with the pretest post-test that is with the mean SD, pretest 9.33 mean, SD 0.846, post-test that is increased that is 14.67, SD 2.841. So P value is 12.901, which P value is less than 0.001. So in the table 2 association we are in the pretest level of knowledge on the complete awareness and the consumption of millet with the socio-demographic variable. There is no any association among the socio-demographic variables on the level of knowledge among the young adolescents. Discussion with the findings of my study. Study compared with the other that is studied by the Anita S. Data in the peri-urban Karnataka, so millet-based meal day means to 1,500
Yes, ma'am. I'm sharing my slides now.
Yes, ma'am. You can start.
The screen can be seen, ma'am.
Yes, ma'am. You can proceed.
Good afternoon to one and all. So I am Ms. Nazmi Lepcha. I am going to present my topic on body image dissatisfaction, depression and anxiety in postpartum women residing in the urban and rural areas of Capital City. So going on with the introduction, the postnatal or postpartum period refers to the time immediately following childbirth and typically lasts for 6 weeks. So during this time, mothers undergo significant physical and emotional changes, including body image dissatisfaction, and according to WHO, 10% of antenatal women and 13% of postpartum women globally reported psychological problems, where depression considered the most common in perinatal period. So during this transformative phases of nursing and pregnancy and the postpartum period, a body's image, woman's body undergoes significant alteration which can lead to a reassessment of her body image. So this dramatic physical shifts often trigger increased scrutiny and potential dissatisfaction with one's figure, appearance and perspectives on weight gain. So the increased awareness can lead to body image concerns where a person can have negative thoughts and feelings about the body and its shape and appearance. So moving on to the problem statement, so it is body image dissatisfaction, depression and anxiety in postpartum women residing in urban and rural areas of Capital City. So objectives of the study were to estimate the body image dissatisfaction, depression and anxiety among postpartum women, and to find a relationship between body image dissatisfaction with depression and anxiety among postpartum women, and also to find the association between body image dissatisfaction, depression and anxiety with socio-demographic characteristics and postnatal profile of postpartum women. So moving on with the research methodology, the research approach is quantitative research approach and it's a community-based cross-sectional study design, urban and rural areas of Capital City taken, and the study population is postpartum women residing in urban and rural areas of Capital City, and the sample were postpartum women. So inclusion criteria were postpartum women aged 19 to 40 years old who underwent cesarean section and normal delivery, and within 4 to 6 weeks of postpartum period, having live and healthy baby, and able and willing to participate and can speak and understand either Nepali, Hindi and English. So exclusion criteria were postnatal women with stillbirth or congenitally malformed baby, having an uncurrent diagnosis of any other major psychiatric disorder, substance dependence and receiving pharmacotherapy for the same, and unable to give informed consent, and including those with cognitive impairment. So these are the sample size where the sample was 178 and 89 were taken from urban and 89 from rural area. The sampling technique was as follows. Through the district, 6 districts, we did it through the lottery method where urban area and rural area was taken through the lottery method. Urban area 2 were taken, that is Jalgaon and Raniganj, and rural area Ranga and Namma. So preparation of sampling frame was done from the health center and target population was rural area. So these were the data collection tools and technique, where tool 1 was the demographic variables, where age, religion, mental status, etc. was taken, and section 2 was postnatal profile, where there was utilization of antenatal and postnatal OPDs, last menstrual period, date of delivery, etc. So this was done through interview technique. And tool 2 was body image questionnaire, which was a 22-item body image questionnaire, and tool 3, Edinburgh postnatal depression scale, 10 questions were there, and tool 4, GAT-7, general anxiety disorder scale. So this all was done through interview technique. So moving on with the analysis and interpretation of data. So major findings of the data were: section 1, findings related to demographic variables of postpartum women residing in urban and rural areas. We can see in age group 20 to 29 were most were there, where in rural area 55% replicate and in urban area 50%. And then seeing the frequency and distribution according to religion, you could see most of the participants were Hindu by religion, 78% in urban, and in rural 51% Hindu by religion in rural area. So this table shows the frequency and percentage according to marital status, where almost all of the participants were married. And this is frequency and percentage. This table shows the frequency and percentage according to educational status, where secondary education, where mostly the participant had secondary education. And this also showed the husband's educational status, where almost in the urban area 41% were undergraduate, and in the rural area 53% were secondary education. And this was the occupational status, where in urban area most of the postnatal mother were unemployed, and in rural area 42% of them were unemployed. So this was frequency and percentage according to husband's occupational status, where 43% in urban area and private sector, and 51% was self-employed. And this is according to the monthly income, where 63% in the urban rural area had income of 10,000 to 30,000. So moving on with the association, here we can see with the history of abuse and mode of delivery, where we can see cesarean section was most in urban and rural area with 60% and 67%. And findings related to distribution of body image dissatisfaction, we can see mild dissatisfaction was seen in both the areas, in urban areas and rural areas. So this is the findings related to the distribution of level of depression, where almost 91% in rural area and 88% in urban area had depression, less likely it was found. And in anxiety, minimal anxiety was found in both the areas, 72% and 65% in urban and rural. So this was the findings related to the correlation between body image dissatisfaction with the depression and anxiety among postnatal women, where we can see a weak positive correlation in both the areas, which was found with body image dissatisfaction and depression. And findings related to association with body image dissatisfaction, we can see no significant association was found within body image dissatisfaction and demographic variables of postpartum women residing in both the urban and rural areas. And also, if you see the section 8, findings related to association between body image dissatisfaction, we can see here only the significant one item as the time concerned. So we can see body image, there was a significant association was found between body image dissatisfaction and history of miscarriage in postpartum women residing in rural areas. So it indicates that women who have previously experienced a miscarriage may accept the body in a positive manner after successful pregnancy and childbirth. So section 9, findings related to association between depression among postnatal women and residing in urban and postpartum women residing in urban areas Jalgaon, so which indicates that women whose husbands work in the private sector or government jobs are less likely to have depression. So this might be due to stable income, secure income from the husband, which can provide financial and emotional support to the woman, which helps in reducing stress and depression after childbirth. So the last one, the section 11, findings related to association between anxiety among postnatal women residing in urban and rural. So there was no association was found between anxiety and demographic variables of postpartum women residing in urban and rural areas of Jalgaon city. So findings related to association between anxiety among.
Excuse me, ma'am. Can you make the slide show? Your slide is not visible.
No, it's not.
The first slide is visible, ma'am.
Which the rest of the screen not visible.
No, ma'am. First slide is visible. Can you make it to results?
Now it can be seen.
Yes, ma'am. Ma'am, please continue.
I reached the last one now.
Okay, ma'am.
Okay. So, so in this we can see there was no association between anxiety and postnatal profile of postpartum women residing in urban and rural areas of Jalgaon city. So the research hypothesis was rejected here. Moving on to the discussion part, discussion in relation to body-based dissatisfaction of postpartum women. So present study found the majority of postnatal women, whether from urban area or rural area, experience mild impairment in body image. So the findings were generally consistent with the literature by et al. In 2018, which found a majority of women, 63.3%, had a negative attitude towards their body, postpartum body. So discussion in related to depression of postpartum women residing in urban and rural area. So the present study found that majority of postpartum women in both urban and rural areas did not show signs of significant postpartum depression. So in urban areas, 87.6% of women scored in low risk range, and while 12.4% were at possible risk. So these findings were not consistent with the literature by et al. 2023, which reported a higher prevalence of postpartum depression in rural areas compared to the urban areas. So the difference could be due to several factors, including cultural differences in the perception and expression of depressive symptoms. So moving on to the next slide. So discussion in relation to anxiety of postpartum women residing in urban and rural areas. So the present study found a majority of postnatal women in both the areas experienced minimal anxiety. So in urban areas, 71.9% reported minimal anxiety, 28.1% had mild anxiety, and in rural areas, 65.2% had mild minimal anxiety, while 34.8% experienced mild anxiety. So these findings were not consistent with the literature by et al., where they found a greater rate of perinatal mood and anxiety disorders in urban areas and then in the rural areas. So with this, I like to conclude that body image dissatisfaction, depression, anxiety affect new mothers in both the urban and rural areas, and most postpartum women had good support and assess antenatal and postnatal care. So the study emphasizes the need for mental health support, particularly for women facing miscarriage or financial stress, and recommends future research on cultural and regional differences in body image perception and mental health, as well as tracking changes in psychological well-being over time. Thank you. Thank you, ma'am.
Yes, ma'am. Ma'am, can you address the limitations which you faced during conducting the study?
The limitations that I faced during the conducting the study was getting time from the mothers, as it was within 4 weeks to 6 weeks after childbirth. So they were much busy with the child, and the child so giving my tools, sharing with them, explaining them. So the time constraint was there. So that was the challenge that I faced.
So how did you overcome that?
So it took time, and like one day we could not do much, like 3, 4, or 5, 6. So time it took. The time was extended.
Okay, ma'am. Thank you.
Thank you.
So moving on to the next, we have Mrs. Smriti Dalai. Mrs. Smriti Dalai. Yes, ma'am. Can you share your screen? Yes, ma'am. Okay, we share it from our side.
Anxiety is a common emotional response characterized by persistent worry and anxiety, which often active in older adults due to various social, biological, and psychological factors. High level of anxiety can negatively impact both physical and mental health of elderly population. This made it important to explore effective intervention. This study aims to evaluate the impact of Jacobson's progressive muscle relaxation on reducing anxiety levels among elderly residents of significant old age home in this my statement was, the study passes the effectiveness of Jacobson's progressive muscle relaxation on anxiety among elderly in selected old age home at this objective was to assess the previous and post-level of anxiety among elderly population, determine the effectiveness of progressive muscle relaxation technique, to find out the association between its anxiety level among elderly and selected adults. Next slide. Methodology of my study was research approach. I have taken quantitative research approach. So design was first experimental research design, one group pre-test and post-test design. Variable under study was independent variable, Jacobson's progressive muscle relaxation technique. Dependent variable was anxiety level. Setting of the study, entry old age Odisha, sample was taken above 60 years, old age levels. Sampling technique was simple data, sampling technique was taken. Sampling size was 60 sample was calculated in one research study. In my study, in inclusive criteria, I have included in my study 60 years and above old age levels who are willing to participate in my study, and excluded in my study who are deaf and dumb old age levels, who are sick at the time of research, and who are gone undergoing surgery, and who are not present during the data collection process. Data collection procedure, I have obtained critical community purposes and also taking permission from the old age sample informed and consent was taken regarding their participation in the research study. In day 1, pre-test were conducted with the Hamilton's anxiety scale questionnaires. After pre-test, intervention was needed. Jacobson's progression of relaxation technique was given to them, and after 7 days, post-test was conducted process for anxiety levels by scale quiz. Data were analyzed through descriptive and influential studies. Next slide. Here, the table shows that the effectiveness of Jacobson's progressive muscle relaxation technique on anxiety among progressive muscle relaxation is effective on this reduction of the anxiety. In my study, it's revealed a significant association between the demographic profile of elderly residents in Jalgaon and their fitness anxiety level. About 88% of participants had a high level of anxiety, while 21% showed several severe levels. After administering Jacobson's progressive muscle relaxation technique, a notable reduction in anxiety was observed in those cases. The pair-based result confirmed that Jacobson's progressive muscle relaxation technique was highly effective in significantly reducing anxiety level after relaxation. In conclusion of my research study, I concluded that Jacobson's progressive muscle relaxation technique is highly effective in reducing anxiety levels among elderly residents of the old age group. A significant decrease in anxiety was observed in the old states compared to the previous. The findings also reveal a strong association between demographic level and the anxiety levels. Thank you. These are the reference of my research study.
Okay. Ma'am, how did you identify the anxiety level among the samples?
By applying this identification the individual's anxiety skills, I have assessed the anxiety level, and after the anxiety level assessment, I have administered this progressive muscle relaxation therapy, which is a group of muscle relaxation therapy.
Okay, did you face any challenges? Did you face any challenges?
Yes, now as they are old age people, and staying in an old age home, that is very tough for them. And after 60, they are having that is dementia like disorder. So then I feel the difficulty to what instruction I have given them. But they have not properly followed that, so it is taken very much time to make them understand the what is this.
Okay, ma'am. Thank you so much. Moving on to the next, we have Miss Zabanas Sheikh. Are you with us, ma'am? Yes, ma'am. Can you be a little more louder? Yes, ma'am, you are visible.
I have not season my video during this one.
Ma'am, your slide is not with us. Can you please screen share?
I forgot to on my video.
Can you share your slides now? Ma'am, you are muted. We are not able to hear you. Yes, ma'am.
Ma'am, is it visible?
Ma'am, your slides are not visible.
Okay, ma'am.
Excuse me, ma'am. No. I have followed all the video during my presentation. Is it okay, madam?
No problem, madam. This is okay. It's okay.
Ma'am, our video is not supporting.
Jaganas ma'am, you have to share your screen.
Yes, ma'am, our video is not getting supported. Sorry.
Can you send it to us?
Yes, ma'am. 2 seconds.
Till then we will take over the next one.
Okay.
Okay, next we move on to the session of Ms. Renubala Pradhan.
Yes, ma'am. Good afternoon, ma'am. I'm here.
Yes, madam. We will share your screen.
Yes. Good afternoon, everyone. I am Mrs. Godavari, Associate Professor, Dreams University, Odisha. Today I am going to present my scientific paper in this international conference. Thank you so much to Godavari College of Nursing to giving me this opportunity. Actually, I got so much presence presenting to present my topic in last. Okay, I am coming to my chapters. My study is a study to assess the effectiveness of video-assisted teaching method on knowledge and skills regarding cardiopulmonary resuscitation among college students of City Women's College, ODSI, Godavari. I am coming to the introduction. The cardiopulmonary resuscitation is a life-saving technique vital in emergency situations. Many students lack adequate knowledge and skills regarding CPR. Video-assisted teaching method provides visual step-by-step learning experience. This study evaluates the effectiveness of VATM, that is video assisted teaching model, in improving CPR knowledge and skill. Next slide please. When informed studies that cardiac arrest is a leading cause of death worldwide, immediate and effective CPR can round up triple survival rates. Knowledge and skills among college students are often inadequate, and innovative teaching strategies like VATM can enhance learning outcomes. Next slide please. My objectives of this study is to access the pre-test knowledge and skill regarding CPR among college students, to evaluate the effectiveness of video-assisted teaching methods on CPR knowledge and skill, and to compare pre-test and post-test scores to determine the improvement among the college students. Next slide please. Hypothesis was there is a significant difference between pre-test and post-test knowledge and skill scores after VATM intervention, and there is a significant association between the pre-test developed knowledge with the associated developing materials. By taking these two hypotheses, I move on to my research. Next slide. This is the conceptual framework what I kept in my study, that the college students are samples according to their age, gender, course of study, family histories of cardiac diseases, awareness regarding cardiopulmonary resuscitations, and in the group book I have given the video-assisted teaching methods and knowledge and skill regarding cardiopulmonary resuscitation, and in the output that and printed again in knowledge and skill regarding CPR. In some cases they got the knowledge, and in some cases that they have not got the knowledge that I have done after doing the post-test. Now coming to the methodology. In methodology, that my study was quantitative research approach with one group pre-test post-test research design, that is completely pre-experimental research design, and the setting was City Women's College in the Cuttack, which is present in the Odisha, and the sample size was 60 college students, and sampling technique was completely non-probability convenient sampling technique was used to select participants based on their ability and willingness to participate, and the tool was there, the structured questionnaires and also skill checklist. And the AD experimental one-group pre-test post-test design was used to assess the effectiveness of video-assisted teaching methods or knowledge and skill regarding cardiopulmonary resuscitation among college students. And this is the major findings of this study. According to the demographic data, in the age of respondents, that 16 to 17 years was there 42%, 16 to 19 years was 30%, and above 19 years students were 25%. And the further educational qualification is assessed there. It was the informal education was only 5%, primary was 10%, higher education was 45% studies. And again, if we go to the area of residence, that next slide please, that the rural area is 15% students, and from urban area 85% students was there. And from the family history, the cardiac disease, when I have taken the family history, that 48 students have having cardiac diseases in their family, and the 12% students was there cardiac diseases in their family. Next slide please, ma'am. And the interventions I have given to video-assisted teaching methods. A video module demonstrating step-by-step CPR. Next slide please. Yes, a video module demonstrated step-by-step CPR procedure was shown, and the duration was approximately 20 to 30 minutes was there, and covered both theoretical and practical aspects of CPR. And post-test conducted 7 days after teaching intervention like BT. Next slide, please. And this is my analysis table. In the first table is the level of knowledge, and the second table is the level of skills. And what I got is the 20% students was inadequate knowledge, and 40% was average knowledge, and 16% students was good knowledge, and 44% was in the pre-test that 20% was inadequate, 80% was average, and 0 was excellent and good. But in the post-test, after the intervention, the 16% was 16 frequency was there, and whereas the 26.6% were good knowledge, and the 44 students were having excellent knowledge, that is the 73.3%. After my interventions, that is the assessment of the knowledge. And in the skill, when I came to the assessment of the skill, in the pre-test was 26.6% was inadequate knowledge, and 73.3% was having average knowledge. When I came to the post-test, that 70% was having excellent knowledge, and 30% was having good knowledge. So that in the differential statistics, I have used the PRT test was used to assess the effectiveness of BTM on knowledge and skill regarding cardiopulmonary resuscitation, and also the chi-square test was used for identifying the association with the demographic variables. Next slide, please. Next slide. And this is the graphical presentation, so what I can give my story. That in the pre-test it is 9.6%, and in the post-test it is tremendously is increased, that is 25 to 5.5%, that is increased level of the knowledge. And next slide, please, ma'am. There is some invalid. Next slide, please, ma'am. Go to the next slide. And this is the CPR, the pulmonary resuscitation. In the pre-test, the mean was 4.8. And whereas the post-test was 7.1, and the revision was 44.9, the p-value was 2.384, whereas the p-value was 59, and the p-value was 1.0. The significant level is the less than 0.05 level of significance. So what I got that result is that it is completely significant as they are giving my interventions to the students in case of knowledge level. And also in the skill level, when I assessed it, next slide, please, ma'am. That the quantity, the most test was 1, and the percentage of distribution of the mean value based on the skill is also of the, it is completely increased after the interventions. And the results is the next slide. In knowledge and equal share low, and the post-test scale score showed tremendous improvement in statistical analysis level significant difference in the 0.05 significant, and the PhD was found highly effective in improving CPR knowledge and skills among the college students who are completely non-divorced. And coming to the discussion facts, the findings are consistent. Next slide. Next slide, please. The findings are consistent with previous studies supporting video-based learning, and BATM offers flexibility, visual clarity, and repetitive learning opportunities. It enhances both cognitive understanding and also second-order skill retention. And coming to the conclusion, that video-assisted teaching methods significantly improved the knowledge and skill regarding CPR among students. It can be used as an effective teaching strategy in nursing and allied health educations, and regular reinforcement and practical exposure are recommended. And coming to the next slides, implications and recommendation there. Nursing educations incorporate BATM and teaching critical life saving skills, nursing practices involve NCPR competency among healthcare professionals, and in the nursing research, further studies with larger samples and local groups, and in the administration level, provide resources for integrating technology-based teaching. And this is my proposal. Coming to discussion practitioner. Thank you so much.
Okay, thank you, ma'am.
Yes.
There is a question for you. How did you conduct your intervention, like theory and practical of CPR?
Actually, in the BATM, what I prepared my slides only
is muted. Renumala ma'am.
Yes, ma'am.
Yes,
Yes,
ma'am.
ma'am.
You told that you conducted theory sessions and practical sessions of CPR for the samples.
Yes, ma'am.
So how did you conduct the study?
Practical both I conducted theory I conducted by presenting the PPT and also the video assisted teaching I given the teaching again by showing the videos what I was prepared myself for it. How giving the CPR step by step, all the steps.
Did you find any limitations?
Yes, ma'am. Because they are completely unknown to medicals. They are not having any ideas about this CPR. That is why I got some difficulties to make them understand. If they are completely known about these things, that anatomy of the human anatomy of the presence of the heart and all these things, but how to give the CPR is just difficult to make them understand. But I motivated them to attend all the session, both the PPT during theory and also the video for the skill. And when I was taking the post test, that I got that most of the students which were coming little higher educations, and they are done it nicely.
Okay, ma'am. Thank you so much.
Yes, thank you. Thank you so much.
Moving on to the last presentation of the day, Miss Zabara Sheikh. Miss Zabara Sheikh, are you ready with the presentation?
Yes, ma'am, I'm ready with the presentation.
Okay. We'll share the screen.
Yes, ma'am. Good afternoon. Good afternoon, ma'am. Myself is Zabara Sheikh, presenting my paper presentation. So, my next item. So, my statement is first is the effectiveness of structured teaching program on knowledge regarding mother care given among the husbands of primary mothers in selected hospitals of Chennai. Next one. Introduction. Kangaroo mother care, often defined as skin-to-skin contact between a mother and a newborn, frequently or exclusive breastfeeding, or early discharge from the hospital has been effective in reducing the risk of mortality among the preterm and the low birth weight infants. Research studies and programs implementation of kangaroo mother care has been used various definitions. Next slide. Kangaroo mother care is an effective and safe alternative to the conventional prenatal care for the low birth weight infants, mainly in the resource limited countries like kangaroo mother care reduces the mortality and also morbidity in the resource limited settings. Through the further studies are needed. So my aim for the study was to assess the effectiveness of structured teaching program in the husbands of the primary mother regarding the knowledge of kangaroo mother care. Next slide. The objective for my study was to assess the existing knowledge regarding the kangaroo mother care among the husbands of primary mothers. Next one was to assess the effectiveness of structured plant teaching program regarding knowledge regarding kangaroo mother care among the husbands of primary mothers. And lastly, to find out the association between the post-test knowledge score regarding kangaroo mother care among the husbands of primary mothers in selected demographic variables. Next slide. Criteria in my studies was inclusion criteria, the husbands of primary mothers and in the selected hospitals, and also the who were present at that time of the data collection, and in exclusion criteria, the husband of primary mother who were not willing to attend this study. Next slide. So the hypothesis in my study was H1 and H0. In H1, there will be the significant difference
Next slide. This is the main graphical presentation for the human study. Next slide. In discussion, a coffee experimental study conducted to evaluate the father's attachment level to their infant and their participation in the baby's care. The study was conducted between February 2019 and March 2019 with the 106 fathers in the postpartum clinic at MA Part 2 type state hospital in Turkey that were obtained from the control group using father information from the prenatal infant attachment scale, father's participation in baby's care evaluation forms, and father's participation in newborn care scheduled for statistical analysis. The NCSS in 2007 was used. Next slide now. I repeat, next slide. Chasper test and Fisher's extract test were also used in the comprehension sperm and correlation analysis for use to evaluate the relationship between the qualitative variables in the comprehension. The confidence interval was 95% and the statistical significance was taken that was P0.05. And the study was found that the combined method care increases the attachment level of father and their participants in the baby's care. As the participation level of father in the baby's care increased, the level of father-baby attachment decreased too. So the use of ASM is recommended for the father's participation in the baby's care evaluation from to monitor the newborn.
Okay, ma'am. We have time constraint. You have a question. What challenges you faced when you have taken the sample of husbands for primary and mothers?
Actually, there was less cooperation as there were no time in the hospital setting for the father to involve in the study. But I have efforts and I have made a request and I have taken a sample. That's why the sample size was 60. And next time I will do my best for increasing sample size in this study.
Okay, ma'am. Thank you so much.
Okay. Thank you.
Good afternoon. Okay, so we'll move on to the validatory function. So we have, in short, we will have the results of the paper presentation and evaluation. For that, I request the guests with us, the images observer, Professor Melissa Fernandez ma'am, Professor at SMBT Institute of Nursing, Nasik, madam, please come forward. And we also have with us MNC observer, Mr. Pushpendra Nikum sir, Principal of Government College of Nursing, Jalgaon. Along with that, we have Professor Department College of Nursing, Jalgaon, and our Principal ma'am, Professor Vishana Kandil ma'am, Vice Principal Professor Jacinta ma'am, and Professor of Maturity of Mental Health Nursing, Professor Ashwini Vaidya ma'am, to please come forward for the award ceremony. And now it's time to announce the results. The cash prize was sponsored by SR Healthcare and Academic Foundation, the academy which is devoted to promoting excellence in nursing, research, clinical skill development and innovation, empowering faculty and students to contribute meaningfully to healthcare advancement. So we had a total 38 participants for e-paper presentation, and it was very difficult for the judges to scrutiny and finalize the results. So in short, the results will be announced by our Vice Principal, Dr. Jason Diamond.
Before announcing the results, I would like to call all the assessors, judges of the session, Professor Abibullah ma'am, Professor Manora Kashyap ma'am, Professor Vinodini ma'am, and Professor Emati Mutite ma'am. Please come on this one. Thank you all the participants. So it's indeed very hard for us to decide the first and second place of this paper presentation. And we have total of 38 presentations. It is very hard for us to announce the first and second place. So it is a jury of 8 members. So we have finalized that the second prize goes to Miss Kavita Vasandrao Kadam on her study Effectiveness of Food Reflexology on Pain and Lactation among Post-Cesarean Mothers admitted in Tertiary Care Hospital, Karat. I repeat, the second prize goes to Miss Kavita Vasandrao Kadam. She will be honored with the cash prize of 4,000. And now it's the time to announce the first prize. The first prize goes to Dr. Nitanjali Patil on her study Effectiveness of Sesame Oil on Prevention of Livitis among Patients Receiving Chemotherapy. I repeat, the first prize goes to Dr. Nitanjali Patil ma'am. Congratulations for all the winners on behalf of Godavari College. And I want to extend my thanks to all the juries who have joined with me in this section. Thank you. And the prize money for the first place is rupees 6,000. Congratulations everyone.
Thank you so much, ma'am. So hearty congratulations to all the winners of scientific research paper presentation. It's truly a proud moment for all of us to be a part of international conference. Now, let's take a moment to capture these wonderful memories in a photograph. Good. Thank you, madams. Now we will distribute the certificates of participation. We have with us the students and faculty from Harsh Institute of Nursing, Jalgaon. So I call upon all the students and faculties who have come from Harsh Institute of Nursing, Jalgaon. All the students and faculties are requested to come forward. I will request the guests to please come forward for the photograph. Ashwini Bedina, please. Upendra sir, please come forward. Shivana sir. In between, there is a reminder for the delegates. Kindly fill the post-test and feedback link sent to you through the WhatsApp group. Because if you not send the feedback link and post-test, your certificates will not be delivered. From Dr. Prafulla Patil College of Nursing, Parvani. Dr. Prafulla Patil College of Nursing, Parvani. Next we have
from Dr. K. Patil College of Nursing, Jalgaon.
That
invite all the faculties from Godavari College of Nursing to have a photograph. All the faculties from Godavari College of Nursing. All the teaching faculties of Godavari College of Nursing. Organizers of the International Conference 2025, who are behind the program day and night, all the organizers are invited for a short photograph. Everyone, non-teaching and teaching faculty. So behind every spectacular event lies weeks of tireless efforts, endless rehearsals and passionate teamwork. We had a great teamwork and today's ceremony is a shining example of just that. It was a heartwarming to see so many smiling faces present from yesterday with us, revealing in this new journey of opportunities. To bring this event towards its conclusion, we believe a token of gratitude is in order. So I request Professor Jacinta Ma'am, Vice Principal of Godavari College of Nursing, Jalgaon, to express the gratitude by proposing the vote of thanks. Okay, before that, will anybody would like to give feedback of this 2 days conference? Can come forward.
First of all, good afternoon all of you. Myself, and I am a second year nursing student from Harsh Institute of Nursing, Jalgaon, Gujarat. Today, we are here as in the international conference. The international conference basis on the embarrassing digital pulse of nursing. What is the digital pulse? The digital pulse can be divided into two main facts. I believe that the first one is the rhythm of the innovation and the second one is the human connection. The rhythm of the innovation is nothing but the evolving and the digital things innovations which is present in the nursing faculty. And the human connection is the thing where the replacement of the harmonization of the innovation skills are getting day by day evolved, but the not replacement of a touch with the peaceful and the palliative care. Thank you so much.
So these are the senses who have given their valuable feedback. Any other person? Yes.
Good afternoon, everyone. I am truly grateful for the opportunity to attend the international conference on tech, enabled era, embracing the digital pulse of nursing, organized by Godavari College of Nursing, Jalgaon. Talking about the sessions were highly informative, inspiring, and that were relevant to the current trends which are in the healthcare. The speakers shared their valuable knowledge, experiences on how technology can enhance the insight of technology on nursing education, research and education. The discussions on the digital transformations, AI usage in the healthcare and the e-learning tools which has broadened the knowledge of the students as well as the faculties present over here. These 2 days were really very nice as we had come from far and near and had a great experience. Coming to the organizers, the organization and the coordination of the event was excellent, starting from the registration, from the hospitality, along with the cultural programs, along with the breakfast, delicious breakfast and lunch. Everything was well managed and well organized. So I would like to thank Vishaka ma'am and the entire organizing team for organizing such a wonderful conference, international conference of 2025, and indeed it was a great learning experience that motivated and explored the technology-based approaches in the practice and education. Thank you to the organizing committee and also those who have worked behind the screen or the technical team and those behind the team. Thank you everyone.
Thank you so much ma'am for your valuable words. Anybody else would like to share their experiences? Usha Chaudhary ma'am, Ruchita ma'am. Thank you, madam. Anyone else would like to share? Last 2 days experience. Anybody who has come from outside? Our college students are familiar with our environment. Anybody from outside? Okay. Now moving on to the words of gratitude, I request Professor Jessica Ma'am, Vice Principal of Godavari College of Nursing, to share a few words of gratitude.
Good evening, ladies and gentlemen, esteemed colleagues and distinguished guests. Myself, Professor Jessica, Vice Principal, Godavari College of Nursing. And it's my honor to stand before you to deliver the vote of thanks on behalf of Godavari College of Nursing. As we conclude this remarkable international conference 2025. Over the past 2 days, we have experienced a truly successful event filled with engaging discussions, insightful presentations, and valuable networking opportunities. Together, we have transformed our goals into reality, and for that, we are immensely grateful. I would like to express our gratitude to our President Sir, Honorable Dr. Ullas Patel Sir, ex-Member of Parliament. His vision and guidance have been instrumental in shaping this conference. As he has said, education is the foundation upon which we build our future. His dedication to empowering the next generation is truly commendable. I would like to extend our deepest gratitude to our Dean, Faculty of Nursing, MFHS, Dr. Srilekha Rajesh Ma'am, Professor cum Vice Principal of GMO Foundation, K.D. Grant Institute of Nursing Education, Pune, for delivering a captivating keynote address. Your insights and expertise have set the tone for our conference, inspiring us all to think critically about the future of nursing education and practice. Your words have not only informed but also motivated us to strive for excellence in our respective fields. Thank you for sharing your valuable perspectives, ma'am, and being a guiding force in our discussions. And I would like to extend my heartfelt appreciation to our esteemed speakers, Dr. S.J. Nalini ma'am, Professor cum Principal, Sri Ramchandra Institute of Higher Education and Research, Poro, Chennai, for her presentation on expanding access to care through telehealth. Your section helped us understand how telehealth makes healthcare more reachable and convenient for everyone, especially those in remote areas. Thank you, Dr. Nalini ma'am, for sharing your knowledge and encouraging us to use technology to improve healthcare services. We would like to also express our gratitude to Dr. Maria Jessica Motul Laguno ma'am, Assistant Professor, Fahi College of Medical Sciences, Saudi Arabia, for her engaging presentation on digital skill for nurse leaders. Your emphasis on digital skill for nurses has enriched your understanding and will undoubtedly impact our future approaches. We sincerely thank Dr. Abhi M. Abdul Kader, Associate Professor, College of Applied Medical Sciences, King Faisal University, Saudi Arabia, for her insightful discussion on digital tools for crisis management. Your talk clearly shows how digital tools can help manage crises more effectively in healthcare settings. We sincerely thank Dr. Vaishali Bhuti ma'am, Krishna Vishwavidyapith, Krishna Institute of Nursing Sciences, Karat, for her informative session on privacy, ethics, and legal consideration in telehealth nursing. Your talk helped us understand the importance of maintaining patient privacy, following ethical practice,
of care. Thank you, Mrs. Srijana ma'am, for your insights and motivating. Nasik for leading the session on chatbots and virtual nurses. Your insights and expertise have provided us with valuable perceptions on enhancing the clinical education, and we are grateful for your contribution. I would like to extend my heartfelt gratitude to Ms. Melissa Fernandez ma'am and Professor Adimulam ma'am for joining us in the e-paper evaluation. I would like to extend my sincere thanks to Dr. Nigam sir for his constant presence since 2 days and constantly observing and motivating us and guiding us. We extend a heartfelt gratitude to Mr. Praveen Kohli sir, Nursing Administrator, GCOA, for his constant support and dedicated efforts that play a key role in the success of our conference. Your inspiring leadership, encouragement and commitment have motivated everyone and created an environment that promotes teamwork and innovation. Thank you, Mr. Praveen Kohli sir, for being a true guiding force throughout this journey. Let us take a moment to appreciate the outstanding efforts of organizing committee. Your hard work, dedication and teamwork have been the backbone of today's event, success of this event, and we are truly grateful for your contribution. And a special thanks goes to our principal ma'am, Professor Vishaka Gandhi, for her unwavering support and visionary leadership that played a crucial role in making this conference possible. A special thanks to the registration committee for managing a smooth and efficient check-in process, and the food committee for their thoughtful arrangement that kept everyone refreshed, energized throughout the conference. I would also extend my gratitude to the e-paper presentation committee and evaluators for organizing engaging and innovative sessions, and also the cultural committee for bringing creativity and vibrancy that made the event even more memorable. A heartfelt thanks to the welcoming committee whose warm hospitality made every participant feel valued right from the start. We also appreciate the efforts of technical and sound engineering team and the stage arrangement team whose professionalism ensured that every session ran smoothly and successfully. Thank you all for your teamwork and dedication, which made this conference truly remarkable. We extend a heartfelt thanks to our sponsors and partners, Maharashtra University of Health Sciences Nasik, Indian Nursing Council, Maharashtra Nursing Council Mumbai, and SR Health Academy and Research Innovation Hub. For your support reflects your commitment to our shared vision and has helped create a vibrant community. A special mention goes to our offline participants. Your presence has made this conference dynamic and engaging. Connecting face-to-face has allowed for deeper interactions and meaningful discussions. Your active participation has greatly contributed to our achievements. To your online participants, we appreciate your engagement and insights. Your involvement highlights the power of technology in bridging distance and guiding us all, which made justice to our topic. Finally, I want to thank each and every one of you, both in person and online. Your questions and contributions have fostered a sense of community that we can carry forward. As we conclude, let us take with us the knowledge and gained and the knowledge we gained and the connections we made. Thank you once again for your participation.
Thank you so much, ma'am, for the words of gratitude. So by this we come to the end of today's international conference. So I would like to quote something. Life is like riding a bicycle. To keep your balance, you should move on. Keep on moving. So by this signing note, I, Ms. Nimbi Varghese, sign off from the road. Thank you. Have a good day. I request all of you to kindly stand for the national anthem. Thank you all.